ano doc, skipping rope, yung skipping rope and box jump. I think parang yun yung nag-trigger.
Okay, so
Pero I think meron na siyang existing kaya lang parang na-worsen siya nung
worsen.
mga skipping rope. Oo.
Okay, so meron kang chronic, meaning existing, tapos may acute pa, may bago na stress. That is something very interesting.
Bluetooth mode.
Yes, Ma'am Jessica, you were saying? I couldn't hear it, pero baka you have something to share, Ma'am Jessica.
Ma.
Ay, si Mother. Morning po, Ma'am Jessica. This is Dr. Joe from Cebu. Hoping to know where you are from. You can type it in the chat if you are not very. Just want to know po kung saan kayo galing. Anyway, that's my story. I want to share more about osteoarthritis. This is an example, a diagram of the joint. You have cartilage, itong blue part, and yung brown part, yung may bone. When you have severe osteoarthritis, the cartilage thins down. Yang yung blue, no? It's thinning down. That's early, this is advanced, and this is the end stage natin na degenerative disease na wala ng cartilage, yung bone na lang on bone. Like I mentioned kanina, it's like a car wheel na wala ng rubber. So pag yung gulong wala ng goma, it's going to be very painful, no? Normal knee is on the left. Severe arthritis, degenerative osteoarthritis is on the right side po. So if you have any idea about what your x-ray looks like, dapat kasi yung x-ray on the left, you have joint space. X-ray on the right, halos wala ng joint space, and that is where your cartilage is gone, the meniscus is gone, pag sobrang severe na. These are some of the patients that I see. Of course, I know a lot of patients are afraid of injections, afraid of surgery, so I try to give them pain relievers and anti-inflammatory po na mga medications. One of the safest na medications that you can have or you can take, and you can always ask your other doctors, your internists about this, is yung paracetamol. Kasi this is in our guidelines that we can use paracetamol 3 times a day. And this is safe for the kidneys, it's safe for the liver. Of course, always ask your internist doctors before you proceed to the more potent, more powerful pain relievers po, ano. So, going sa these are the more powerful ones, yung sinasabing naproxen, yung mga arcoxia. These are the pain relievers that can damage your kidneys and that can also damage your gut. I've had patients na kasi that I've seen in the hospital, nasa ICU na, nagdadialysis na, nasira na yung kidneys, na butas yung tiyan because nag-ulcer na. So I'm hoping po na
Nakita man.
you try to
Bayos?
consider po yung paracetamol before you actually take the stronger painkillers po. Injections, pag sobrang maga na yung tuhod, this is an option for pain relief. And the patients always ask me, Doc, how long yung effect ng mga injections? The truth is, it really depends on how bad or how severe yung arthritis nyo is. For really severe cases, pwedeng few weeks na lang yung effect. For less severe cases, pwede po kasi na yung effect can last for a few months or even a year po. This is a knee replacement. This is when everything else has failed. Yung patients natin dito sa Pilipinas, marami ang takot, no? A lot of the patients are afraid, and this is because they think na hindi na sila makakalakad. This is not really true. A lot of my patients are walking after a knee replacement surgery, and this is something that I tell them only if everything else has failed po. Yun po yung knee replacement. This is an x-ray of a knee replacement patient that I did both knees. Tapos, I will end here for our osteoarthritis part. I also want to tell you na merong iba't ibang klase na arthritis. I get messages po sa chat na, Doc, ano ba yung gamot ko? It really depends on what form of arthritis you have. Rheumatoid arthritis, can be from a weak immune system that attacks the joint. So it causes this type of deformity sa kamay, and you can have morning stiffness, arthritis of the hands, nodules in the body. These are some of the things we look for. Rheumatoid arthritis compared to osteoarthritis, diretso nawawala yung joint space. There's no squaring of the joint po. So this is a comparison of the two different parts, two different knees, yung arthritis na osteoarthritis on one side and yung RA or rheumatoid arthritis sa kabila. Again, both can be very painful, except in rheumatoid arthritis, the body thinks that the joint is foreign, so inaatake ng mga cells natin yung sariling joint natin. That's the difference between the rheumatoid and the osteoarthritis po. Very common nagtatanong, Doc, ano po yung mga foods for arthritis? And a lot of the patients and doctors think that it is because of the food yung nagko-cause ng arthritis. So to clarify po, meron talagang arthritis caused by food. Yun po yung gouty arthritis. Yung uric acid crystals will accumulate in the joints kasi hindi nila ma-excrete or mapapalabas. That's why it accumulates in the big toe, gaya ng patient na to, na mamaga usually yung big toe ng mga patients po. So you have swollen uric acid in the joint, starting with the small toe. Later po, magkakaroon ng bigger joints na affected na, yung ankle at saka yung tuhod. So it can be so severe na you have crystals all over the body po. Ito yung arthritis na caused by food. But it also does not mean na yung ibang arthritis cannot be affected by food. We know na yung rheumatoid arthritis can be caused by the immune system. Yung osteoarthritis is the wear and tear na dahan-dahan nangyayari. There is also the arthritis that can be cured. Sinasabi kasi nila na arthritis has no cure. It is for the other forms of arthritis. Dito sa Pilipinas, ang daming may patients na may TB. TB can affect the joints. Yun po yung TB arthritis. Meron po tayong patients na akala nila meron silang tumor pero hindi pala. It is actually tuberculosis. For the National Tuberculosis Program, unlike po sa lungs na TB na 6 months lang, minimum is 12, maximum is about 18 months yung treatment pag TB ng joints. And it is curable po. Libre din po yung gamot natin sa DOH na mga centers natin po, no? So, this is the most important part. This is the joint gut axis. Lahat kasi ng kinakain natin, the food that we eat can affect our joints. Our hands, our knees, and the different joints in our body can be affected by what we eat. Bakit kaya? Because the food that we eat affects the bacteria, the normal bacteria na nasa tiyan po natin. And if affected po yung mga bacteria na normally in the gut, that causes inflammation din, pamamaga. Yung dysbiosis, meaning the change in the bacteria that we eat or the bacteria in the tummy can cause chronic inflammation. So if we keep eating those pro-inflammatory foods, which we will talk about later, you will have inflammation, and the inflammation caused by so many different bacterial changes, it can cause gastric ulcers, it can cause appendicitis, Crohn's disease, even rectal cancer, no, can be caused by the different bacteria. We have to understand, kaya this is the reason why probiotics are flourishing. Ang daming nagfo-focus na nagbebenta ng probiotics because the immune system is affected by the food that we eat. And that's why they're targeting yung mga companies giving probiotics. And it's not just the Yakult. There's so many different companies na nagbebenta ng probiotics ngayon because they know that changing the bacteria in the tummy can lead to diabetes, cancer, liver disease, magkakaroon ng aging, hypertension, and so many other diseases po. In short, dysbiosis, changing the bacteria in your tummy, can cause inflammation and arthritis development. I want you to understand na may good naman na inflammation, may good stress naman, like exercise. But when you have too much inflammation, too much stress, of course, you will break down. And this is something in all the diseases po. Lahat ng mga sakit natin, we have too much stress, too much inflammation inside the body. It could be mental stress, mental inflammation, inflammation in the brain. If it's diabetes, it's inflammation in the pancreas, and if it's a heart disease, there's inflammation in your vessels and in your heart po, no? Now, the thing is, inflammation, chronic inflammation, meaning matagal na po, can lead to disease and arthritis. Now, what are the pro-inflammatory foods? Ito po yung mga processed meats, grains, snacks, chips, sodas, fried foods. This is so interesting kasi I actually am guilty, no, of eating processed foods. Kaya lang, at as kids, mga bata, they love hot dogs. Hindi kasi sila affected masyado. Kasi ang good bacteria nila sa tummy is marami pa po. So the inflammation is there but it's very minute. They will not feel it. Pero pag ako kumakain ng hotdog, I already feel it na hindi nagte-take yung chan ko ng hotdog maayos. Even mga ice creams, I have lactose intolerance, or I thought I had lactose intolerance, but what happens is I need to really go to the bathroom po, no? Pag kumakain ako ng processed foods. It really affects the mind and the body and your joints as well. Yan yung point ng avoiding processed foods. You also have processed meat like bacon na sobrang sarap, but right now I'm trying to cut out on bacon. If bacon, I try to make it myself. Hindi na yung honey cured, no? Because the more sugar, the more the inflammation in your joints, the worse your arthritis can be. So these are the different foods that can worsen your arthritis. The processed meat, and these are fried foods like the chips, lots of sugar like the cookies, and of course sa Philippines, we cannot avoid rice and bread. Ito yung di natin alam na pwedeng cause ng ang daming Pilipino na may arthritis because we are a nation of rice eaters and bread eaters. Tayong lahat. And there is actually a better option, and we'll talk about that later. What are the different options instead of eating these pro-inflammatory foods? The fried foods like the kwek-kwek, chicken skin, sobrang sarap, but we don't know that the thing they put inside can actually worsen our arthritis if we have arthritis and we're taking all these processed food, sugar, fried foods. You may notice a worsening of your arthritis. And for some who have already severe arthritis, you may not feel it in your joints, but you can feel it definitely in different parts of the body. Sa tiyan nyo po, sa chest, or even the muscles, no? So, French fries, of course, is something na, again, guilty po tayong lahat siguro dito, or ako. But I also pay for it afterwards. Even though masarap siya habang kumakain tayo ng mga chips, ng mga fries, ng mga cookies, masarap kasi siya, I have to admit. But later, few hours later, I feel it na sa tiyan ko, na sumasakit yung tiyan ko. And I never realized this until recently na meron talagang effects. But what we want is the feeling, the taste during the eating part. Nakakalimutan ka na yung feeling ng tiyan ko na sumasakit na pala 3 hours, 6 hours later, or the day after sumasakit yung tiyan ko. I don't feel as good. I've started to listen to my body, and I hope you do too. You listen to your own body because kayo lang nakakaalam kung anong kinakain niyo po. Now, what are the anti-inflammatory foods? Ito na po yung mga pagkain na we can eat that can actually improve the pains in our body, not just the joints, because they are anti-inflammatory. That means all diseases can be lessened if we eat these foods. Fatty fish like salmon, mackerel, and mga deep sea sardines. These are rich in omega-3 fatty acids, very good for your joints and for your whole body as well. Instead of yung white rice, you will see people eating black rice, brown rice. These are the whole grains that are actually good for you, better than the white substitute natin. So if you can, if you have arthritis, you can try this definitely. Because again, not not everything is the same for each patient. Meaning, for some patients, baka gusto nila brown rice, yung iba, mas gusto nila yung black rice, yung iba naman walang effect brown or white, masakit pa rin yung tuhod nila. Now, our parents will always tell us, uy, eat ka ng vegetables. Green leafy vegetables is very good, yes. Colorful vegetables and also the fruits, that can be a lot better than eating processed sugar like cookies and cakes na makaka-increase ng inflammation, chronic inflammation sa katawan. These can be the better option. And of course, you have to know din if you have diabetes because some of the fruits can also be, even though hindi siya processed sugar, it can still spike your diabetes po. Instead of chips, instead of French fries, I would recommend walnuts and almonds. There is a misconception no, pag na mataas yung uric acid or yung gout, na bawal yung peanuts. Yes, peanuts. Pero if you have high uric acid, maybe you can lessen your intake of nuts. It's not really directly correlated to almonds and walnuts. But pag severe na talaga, you may want to avoid this for a while. Pero for osteoarthritis, rheumatoid arthritis, pwedeng-pwede to. It's anti-inflammatory. And this is the big secret po. The big secret is that yung mga companies natin, food companies, are adding sugar in almost all foods. Tingnan niyo po yung label sa mga delata, sa mga mushrooms, sa mga sauces. They're adding a little bit of sugar. Of course, they will hide the name as glucose, fructose, kahit ano. And they also made the big thing that yung fat daw dati is the enemy. Huwag kayong kumain yan kasi mataba. Yung low fat na milk, bilhin natin. Yung low fat na meat, bilhin natin kasi yung fat can cause heart disease and all this inflammation in the body. That is so not true. But the problem is, accepted na kasi siya sa sobrang daming nations. Hindi na nila mababago because long ago in the 1960s pa yan, yung mga research, binayaran kasi sila ng mga sugar companies para gawing fat yung enemy. Kaya hindi mo makakita na ngayon lang lumalabas yung low sugar options. Pero dating-dati pa low fat yung mga options natin. This is the big secret I want you to take home with you. Check the food that you eat. Check the labels. Be aware na yung mga sauces nyo, yung mga canned foods nyo, yung mga processed foods, they might add sugar and this can worsen your arthritis. And I want you to join the 7-day challenge, and this is a free challenge for everyone to join po. I'm going to post one video a day dito po sa Facebook groups na Hip and Knee Arthritis Philippines. If you enjoy the challenge, then I hope that you can join the next live of Arthritis Academy po. Salamat po sa inyong lahat. If you have any questions, we have a few minutes for questions po and answer because I want to thank you for joining and my apologies ulit para sa mga hindi nagantay sa akin yesterday. Really big fire caused the change in the schedule. Do you have questions po again about your arthritis? I'm more than happy po to answer your questions. Ma'am Jessica, Ma'am Therese, and Sir Edwin po. Good morning. Anyone have any questions po with regards to the arthritis? You can unmute yourself and ask questions or sa chat po. Pwede kayong magtanong sa chat if May I ask po, Ma'am Jessica, kung ano yung arthritis na meron po kayo? Good morning, Ma'am Eva. Good morning, Ma'am Jessica, Sir Edwin. Can you hear me po? Baka naman hindi ako naririnig. Nagsasalita lang ako dito. So, if there are no questions, I'm really happy to end this session with all of you. Jessica, nag-message sa akin, osteoarthritis po yung result sa x-ray. Okay. So, osteoarthritis. So, meron tayong osteoarthritis patient. So, definitely, I hope this helps What about the others? Curious lang ako if osteoarthritis din po ba yung mga issues natin, or meron po bang may gout, meron po bang may TB arthritis or rheumatoid arthritis? Wala naman? Okay. Okay po. Good morning, Ma'am Eva. Eva is here. And good morning, Sir Edwin. Message mo na lang kung saan kayo galing because I want to know where you are from before I end the session. We just finished our first live of this month, and I will be sharing this on the Facebook groups po. And I'm inviting everyone to join the 7-day challenge where we will try to identify yung mga sugars po na makakause ng inflammation and that can worsen the arthritis. From Leyte. Oh, so we have a arthritis warrior from Leyte. Meron po tayong arthritis warrior from Bacolod. Ma'am Eva, you can message also where you are from para just want to know, curious lang po ako kasi, and Sir Edwin, you can just also message if ayaw niyo magsalita. I hope you guys have a blessed Sunday. Enjoy your day. When po ang 7-day challenge? Aayusin ko po, Ma'am Therese, no? Likely it will be before the month end. So next week, I'll be posting videos po. Yung 7-day challenge is free to join. It's just going to be posted 1 video per day po sa groups po natin. Sa Facebook groups na Hip and Knee Arthritis Philippines. Okay. Sige po. So, there's a patient asking about femur neck fracture po. Femur neck fracture definitely needs to be treated po. It can worsen, the bone will not heal, and it can also cause yung tinatawag na post-traumatic arthritis. Yung post-traumatic arthritis is na masisira din po yung joint po. We have patients from actually Manila pumunta dito sa Cebu dahil merong femur neck na fracture na operahan tapos hindi gumaling. So nagkaka-arthritis na rin yung hips, and ginagawa namin is yung knee replacement po. So I'm hoping that answers your question po sa patient natin na mayroong femur neck fracture, and you can definitely see me sa clinic po with regards to your fracture po. Kasi magkakaroon din tayo ng arthritis pag ganun po. So if you have no other questions, mga arthritis warriors, I will see you next time. We have few minutes left din kasi yung Zoom ko magka-close na rin po.
Okay.
Okay po. Again, have a blessed Sunday, guys, and have a great week. I'll be posting yung 7-day challenge and this video sa groups po. Bye-bye.
Thank you.